Hi, Dr. Choucair. You know, Botox has been done for years and years and years, but some patients who've never done it like to kind of know how it looks or how it works. So this nice lady is allowing us to inject her today on camera. And so there's three main areas we do Botox, and they're the tried and true areas in the upper face that Botox works the best by basically temporarily stopping a muscle from moving. It's very precise. You know, Botox has been around since the 70s, so it's not a new drug, and it's been obviously expanded to use in many different areas, and of course the cosmetic application is one that gets the most attention. Now that's being done for migraines and for other reasons. So in this nice lady, if you'll look kind of mad, this is the one area. Now Laura has had Botox before, so she doesn't have a lot of motion here, but many times the motion here is that motion that shows anger or concern, and it usually lasts about 3 to 4 months, and in this area there's somewhat of a cumulative benefit the more you do it. So we're going to inject this muscle and this muscle that creates that motion, and then wrinkle your nose if you would, and then we're going to inject this muscle that creates the wrinkling at the top of the nose. And in some cases, if you wrinkle your nose, we'll inject these muscles, which are separate, which create that bunching of the nostrils. Some people like that and some don't. The other area that's very common, if you'll raise your eyebrows, we'll inject the forehead to stop some of that motion. But patients who look really weird with Botox have too much injected in their forehead, and there's hardly any motion when they express, and that's noticeable. If you knock out this motion or this motion, no one notices that. But if you talk to people and they can't show expression with their eyebrows, that's very noticeable. And those are the patients that typically look like they've been, quote, done. So in the forehead, and in today's case, we're not going to inject Laura because she doesn't have much motion. We're always careful to leave motion in the forehead. In fact, if you knock out all the motion, the eyebrow can drop, and no one likes that. So we're going to leave this alone today. The third area is the crow's feet, and if you'll give me a big smile, we can obliterate about 80% of that motion with Botox. Again, it only lasts 3 to 3.5 months, but it stops the muscle just here from crinkling as much. If you knock that out, nobody notices. So again, we're going to treat the areas that really are hard to create any problems with, because if you don't have motion here and you don't have too much motion here, it flies under the radar. So first thing we do is make sure we clean the skin. And you know, patients say, well, you know, Botox should never be done outside a doctor's office. It's really not true. It really depends on the person who's on the other side of the needle than where it's done. So you know, we have Botox parties and things like that that get a bad rap. I agree, but it really matters who's doing the Botox. And the problem is, anybody can pretty much do Botox if a patient will let them. It's become somewhat ubiquitous. So we're cleaning the areas we're doing the Botox in. And how much we use depends on how much of a muscle is moving. That's how we determine how much Botox to use. Is the bigger the muscle, the more motion, the more Botox we use. And Botox has become a generic term, kind of like Xerox or Coke. There's also other products, but we're actually using the true original Botox today. We use a little cold spray for comfort, and we're going to start right here, Laura. And we're going to have you kind of look mad and relax now. And we're going to spray with cold, and that cold just decreases the discomfort from the injection. And I'll have you kind of look mad again for me and relax. And here comes that little pinch, and we're shaking on purpose to kind of distract your nervous system. And we're going to put a small amount right in that muscle. Done there, and you can see there's a little bump. We hold that down, and then we'll do this muscle and then that muscle. Doing okay?
Yes.
So there's certainly nothing wrong with a nurse injecting Botox or even a medical assistant, as long as the doctor is in charge of that. In my case, in our practice, in our plastic surgery practice, I still enjoy doing it, and I think there's a value added with a surgeon doing it, because many times people come in and think they need Botox, and they really need something else that's more effective and more beneficial to them. So that's the reason I still do it. You might cover your eyes. We're going to do this muscle now, and then muscle between your eyes. And look kind of mad for me again, and relax now. Here comes the little injection in this muscle. This is the corrugator muscle we're injecting. Putting a small amount there, and then we're injecting the procerus muscle. This is the muscle that moves the lines up and down. So we're done with that. And then what we usually do is have the patient use the muscles more than normal the next 3 or 4 hours. So we'll want her to kind of animate and look concerned or angry because we think it makes the Botox bind the muscle end plate more effectively if they use the muscle. Does anybody really know that for sure? I'm not sure they do, but it's probably reasonable to have someone use the muscles more than normal for the first 3 or 4 hours after injection. Other recommendations are no heavy exercise for 3 or 4 hours, don't sleep on your face, and don't rub the area aggressively for 3 or 4 hours. Those are kind of the points. We usually have patients put makeup on after 20 or 30 minutes because these little needle sticks are pretty much gone by then. It takes usually 2 or 3 days to see any effect from Botox. And 2 weeks is when we tell patients that's when you're going to see your final result, and hopefully it lasts 3 or 4 months. That's kind of the skinny on Botox and how it works. Most patients in my practice will do it maybe twice, 3 times a year. Yes, it may wear off after 3 months, and yes, there are some patients who schedule their next appointment, but that's probably overkill. Most patients, 3 times a year is average. They might see it wear off, but they usually wait a few weeks and then come back. Some people do it once a year. Young patients might do it just once a year to stop the muscle that genetically looks like it's going to really create a crease. So they're doing it in a preventative manner, believe it or not. So there's some rationale for young people doing Botox, but it's usually limited and only by those who have genetic predisposition to have an active muscle. So the next thing we're going to do is treat around the eyes, and we're going to use the cold spray again here because again it really helps around the eyes because the skin is thinner. So I'm going to cover your eye here. Here comes the cold spray. I'm going to have you give me a big smile and relax now. And we have to kind of hit the muscle in multiple areas here. It also gives the outer eyebrow a little bit of a lift usually because you're paralyzing the muscle that normally pulls the eyebrow down. Now we're pretty generous around the eye with Botox because it takes quite a bit to paralyze that muscle. So we usually use around 14 or 15 Botox units around each eye. And that usually will help stop about 80% of that crinkling, and it gives you a little bit of a lift to the eyebrow. Not a lot, but a little bit. And most patients do this and go to dinner, or they do this and go back to work. It's not a major issue. There's a chance you can bruise, so we have people stay off Motrin, Advil, aspirin, those kind of things if they can for 9 to 10 days, but they don't have to. Sometimes, you know, with patients who have it around the eyes especially, we'll give patients an ice pack. And we have arnica pills that we give to many patients, especially with filler, but sometimes with Botox. Many times with Botox, the bruising is so minimal and limited, they don't need it. Most patients don't want it, but some people will take an ice pack, especially around the eyes. And then arnica montana is a well-known herbal that diminishes, we think, the duration of a bruise, so we'll use that in some patients. And as I said, we don't want you to go do a heavy workout for 3 or 4 hours. We think raising your heart rate and blood pressure can change the way the Botox binds. We don't know that, but that's pretty much a common recommendation. Hope that helps you understand how we do Botox.